Well, welcome back. Well, the House Oversight Committee is accusing senior officials in Minnesota of failing to tackle fraud in the state's social services programs, despite allegedly being aware of it as early as 2019. The review says, quote, Governor Walz and Attorney General Ellison clearly did not protect taxpayer dollars, but it is still an open question as to whether this was incompetence, willful blindness, or worse. Walz's team simply saying, quote, Governor Walz is glad to see fraudsters are going to prison. Meanwhile, State AG Keith Ellison's spokesperson told Fox News Digital, quote, the record is clear that AG Ellison fought fraud wherever possible and as soon as he was able to. VP J.D. Vance, meanwhile, is now recommending a DOJ criminal investigation into Walz and Ellison. Watch this.
Clearly, people weren't taking fraud seriously. Whether it rises to the level of a criminal violation, we're going to investigate it. And, of course, if it does rise to that level, we're going to prosecute it. We have to.
Joining me now is CMS Administrator Dr. Mehmet Oz. Dr. Oz, it's great to see you. Thank you so much for being here.
Thanks for having me on.
Well, you are taking on so much, and all of this encompassing the massive fraud scandal that we're seeing, including the Feeding Our Future scandal. Tell us what's going on here and what you've uncovered.
So first, let's applaud Congress for its oversight. It's good to bring this information out. I actually spoke to some of the whistleblowers that they actually had testify, and it's chilling. When I first went to Minnesota, which was in January, and we had been dealing with Minnesota for several months, as they began to acknowledge more and more that they had lost control of the narrative, but also the actual program that Medicaid has to offer in Minnesota, which is these 14 specific issues like transporting people to a doctor's office. Things, by the way, your family would often do for you. The state was paying for it. We have that allowance in Medicaid, but they had not challenged the basic program integrity, which is so critical. You can't just trust somebody. If you have an unlicensed person in an unmonitored setting providing a service that's unclear, you really have to be careful about who you're giving money to.
Wow.
So they had programs like, for example, these transportation to the doctor's office, right? That was supposed to be $1 million a year. I mean, how expensive could it be? Imagine just taking a cab to the doctor's office and getting reimbursed by the state. It was cost them $100 million.
Oh, my God.
Maria, they shut the program down. We insisted on it. Why? Because if you have that much fraud in a program, it's mostly not worth doing. And so now nobody in Minnesota who needs that valuable program could get it anymore because the fraud had gotten so bad. So the whistleblowers basically said the following. We knew there was problems that needed to be addressed. We would raise it to the level of the senior leadership of the health service, who would then take it to the governor's office, and they refused to act. And we would, I wasn't alone. I had investigators with me. We asked, why didn't you do something about it? They said, we were ostracized, we were walked out of the building, and the argument they gave, basically, is you're not allowed to complain about Somalians, because that's racist. And the worst thing you can be in Minnesota is a racist. Now, that to me is ironic because the people you're hurting are often Somalians and other folks who look different than you. So if you don't enforce these systems, and we're not just seeing it in Minnesota, by the way, but in Minnesota it was particularly egregious. I think it woke the country up to the fact that we have to take action. We can't just pretend and be performative in our compliance on these issues. And I think a lot of this lays at the unfortunately, what happened in the prior administration, where in my administration, in my agency that I administer, Medicare and Medicaid, they were basically told to stand down. We don't want to hear about cheating. We just want to get more people on the rolls because that's what good people do.
Unbelievable. And then they complain that we have this enormous debt and these enormous deficits, and yet no one's looking under the rocks. No one's actually, I mean, can you imagine you came in with President Trump and were able to uncover all of this? How long has this been going on?
Well, it's been going on, of course, for years. There's always a little fraud in the healthcare system, but the massive weaponization started during COVID because we taught people during COVID that we'd give money away from the federal government, and we didn't care if you stole it. And we reinforced that by never going after the bad guy. So when President Trump came in, he was understandably livid about this. And as an example of how important it is to the administration, he appoints Vice President Vance to head the anti-fraud White House task force, which has done a fantastic job, Maria, doing one really important thing. All of government's involved. So if I have a problem, if I notice a financial variance that doesn't make any sense, like instead of costing $1 million, it's $100 million, I can call the Department of Justice or the FBI. And by the way, both of us together last week went to Ohio. It's not just a blue state issue. Red states have concerns as well. But at least in Ohio, they're engaging us a bit. We can call the Treasury. Scott Besson's team can now look at money laundering, because where does the money actually go? Remember, we catch the small-time perpetrators. The real scum are the folks up high on the food chain who take the money, launder it, clean it, and they often ship it overseas or hide it in accounts. And some of the big busts that we've made, like the one in Los Angeles with Bill Saili recently, where we actually busted into a house that was owned by a multi-millionaire doctor and his nurse wife. They're Filipino origin. These individuals had stolen millions and millions of dollars from Medicare.
Unbelievable.
In hospice, and they now spread out that wealth in all kinds of cars and vacation homes and their beautiful mansion that we actually cut into with our Humvees.
Wow.
and took them out. Those are the kinds of actions that unfortunately we have to take because the system hasn't been patrolled.
That is incredible, Dr. Oz. Now, tell me more about this trip. You were in Ohio last week. You were with President Trump's anti-fraud task force, and you said that it was at least 49 home health care providers that have been suspended over their questionable billing practices.
And the ironic thing about Columbus, Ohio, where we were doing the press event, second biggest population of Somalians in the country, by the way, is that little area is responsible for 3 times more Medicaid money being spent than any other part of Ohio. It makes no sense that you have that much money being spent there. And so there have been opportunities for us, and states can do this, to catch up to the bad guys. But they actually have to work together with all of law enforcement. Same thing we're doing at the federal level. And when the president and vice president speak of an all-of-government approach, we mean bringing in the state groups as well. So Hawaii, for example, which has like all states, an obligation to patrol Medicaid, that group had not had any convictions or any indictments of fraud in Medicaid for 5 years. So the Office of Inspector General, led by Marsh Bell, actually has suspended that program now, essentially federalized it. So we're no longer reimbursing Hawaii until they fix those problems.
Yeah.
We have those kinds of positions we're going to take there strong. But probably one of the most powerful things we do is defer spending money. We don't spend the money to the state when they send us bills that don't make sense. We did this in Minnesota.
So how do you do it then? Then how do they get paid even if...
They have to look at the records that we're looking at and clean up the mess. So if you send me accounting, it doesn't make any sense. Some people are getting paid 10 times more for the same service, or suddenly there's a massive increase in spending in one little area. That's a clue to us. And remember, my agency has to spend the money. We spend almost $2 trillion of your federal taxpayer dollars to reimburse states for Medicaid and also pay for Medicare and other programs like the Affordable Care Act. It's important for us to get it right. If the state sends us bills that don't make sense, we're going to stop paying them. We'll defer that money. We did it also to California, $1.34 billion for the last quarter. We're asking states, come meet us in the middle.
Wow.
Work with us. When we send you information, I'll give another good example, is suspending hospices. If you don't make sense to us in how you're spending your money, we're going to stop paying the money. The money will never leave the building.
That is wonderful. That is so important, what you're doing. And this is not the only item on your portfolio. I know you've been traveling a lot, but what you did in terms of the dietary paradigm, the triangle, tell me.
The dietary guidelines. So Secretary Kennedy.
The dietary guidelines. This has actually taken place in schools. Tell me what's going on in medical schools right now.
So the dietary guidelines were an important correction of years-long dishonesty in medicine around what's actually good for you. So years ago, there were papers published that were not correct, and now we know in retrospect, in hindsight, exactly what happened. But they, for example, maligned high-quality red meat, and they supported the white foods, white rice, white flour, white pasta, white sugar, the foods that we know will make you heavy. That's why we're the fattest country on the planet.
Unbelievable.
The reason we spend twice as much per person on health care is we're twice as fat as any other country.
Right.
So if we can get the obesity rates down, make people use food as nutrition and get healthier, it makes sense. How do you do it? To actually operationalize this, you need to teach the people in the medical profession about food and nutrition. When I was in medical school, Maria, you'll like this because it was many, many years ago, I actually ran for student body president and won on the platform that we would put nutrition into the classroom.
Wow.
Now, many years later, Secretary Kennedy has a new food pyramid. It makes perfect sense. We put this pyramid back the way it's supposed to be.
Yeah.
So supporting high-quality, nutritious, wholesome foods, not the junk processed stuff that has been unfortunately infiltrating our food system.
So you turned around the pyramid, and I was so happy that you did that.
And then we're asking all the medical schools to pledge to teach their medical students 40 hours of nutrition. And yesterday we announced a bunch more medical schools pledged to join us, and all the accrediting bodies. The people who test the doctors, they're going to start testing on nutrition.
Very good.
And so we want to get the entire system working better. And, we have this great program, the Working Families Tax Cut legislation created. That's the Rural Health Transformation Fund, the biggest, most ambitious investment ever of money in the rural health care. In order to get part of that $50 billion, we asked states to not only address the food issues in their state, but also to ask their medical schools to include nutrition when they teach doctors and now nurses.
So important.
Half the state said yes.
Yeah.
So people want to do it if we give them a chance.
Exactly. And you just have to sort of lay it out there. And this is going to have an impact not just on people living longer, but I bet on our debt and deficits as well, by the way, because it's expensive to treat all this stuff that was preventable.
The perfect line from Fox Business, I'll tell you right now, 80% of the money we spend on healthcare in America, at least from Medicare and Medicaid, is going towards chronic illnesses we could prevent with better lifestyles.
Exactly.
So if we ate better, slept better, exercised better, these are worth hundreds of billions of dollars of savings to us.
Thank you. That's what I was referring to. So the Trump administration also announcing stricter rules for Americans looking for Medicaid coverage. Talk to us about this, because the beneficiaries part of the Medicaid expansion population must do one of the following: work or volunteer at least 80 hours per month, attend school at least part-time, or participate in job training. Dr. Oz, what do you want to say about these work requirements? And they will take effect in January?
America does best when it works, and its people have to work as well. We created a program with great danger when we allowed expansion of Medicaid and also allowed able-bodied people to be on this beautiful program created 60 years ago, where in order to be on it, you had to be vulnerable. As Hubert Humphrey said, you had to be in the dawn of life children, the twilight of life seniors with no money, or living in the shadows, substance use disorder, struggling. We expanded it to now include tens of millions of people who are able to work but just didn't go to work. And so what the Working Families Cut legislation did, and the president should take credit for this, the president saved Medicaid. By taking out immense amounts of fraud in the system, he saved the program. One of the parts of this legislation was to get America back into the workforce. You don't want to live on Medicaid. You want to be prosperous. You want to make more money than Medicaid can allot you as a federal support for, you're living in poverty. And so right now we're saying you have to work, which means 20 hours a week, participating in the workforce. If for whatever reason you can't, go get educated or go volunteer. Do something to engage your community. Because think about it. You were not put on this planet to sit at home and watch television. The average person who's on Medicaid, who's able-bodied, watches 6.1 hours of television or just hangs out every day.
Wow.
That's not why God put you here.
No.
You have a bigger aspiration. You have agency over your future. Go show what you can do in the world. This legislation encourages you to do that. And Dan Brillman, God bless him, was brilliant at this, runs Medicaid for us. He's out there making sure that states know we will support you in every way. We'll support you financially. We'll save you money by negotiating contracts for you. We'll make it easier to support you with technologies that for the first time allow states to nudge people into the workforce. And here, if you're listening to me and you're on Medicaid, if you're having trouble, come to us. We'll help you. We want to connect you to jobs and opportunities to get you working so America can function.
But by the way, most people want that, okay? Because work creates confidence. Work creates a better life. So, Dr. Oz, you're doing great. We so appreciate your time and your leadership. Thank you.
God bless you, Maria.
Thank you so much. Dr. Mehmet Oz here. Stay with us. We'll be right back.